name is Rakel. I'm an associate professor and director of the integrative medicine program at the University of Wisconsin in Madison. Yeah, integrative medicine is really about health and healing. It's how can we use multiple methods of therapy to match the patient's belief, their culture, their health needs, and use that with evidence-based guidelines, not only for evidence for benefit, but also evidence for harm, because sometimes we just go by the evidence of benefit, but we don't look at the evidence of harm. And then we also want to honor the relationship that each clinician has with their patient, and then use this as a tool to help empower them to understand what's going to work best, built out of that relationship. My main intent initially in the first edition was to provide information to primary care clinicians, to empower them to understand how they can use complementary and alternative therapies, how they can incorporate that into their practice. But not just primary care, chiropractic, naturopathic, other complementary clinicians can also find this to be helpful, as it really doesn't speak to any one profession in particular. It really helps us organize our thoughts in regards to what does the data tell us might work best for a specific condition. For example, hypertension. We have really good medications for hypertension, but what about supplements? What about mind-body? What about just simple breath work? What about DASH diet? What about nutrition? How can some of these other modalities really stack the deck in favor of the body's ability to self-heal? And really that's the goal of this book, is to try and put ourselves out of business. If we're doing our job well, our patients will need us less.
What I think is so good about the book is that we have plenty of textbooks that deal with allopathic medicine, with how do you diagnose and treat medical conditions. And then we have other books that deal with complementary and alternative medicine. Integrative medicine truly does combine the two. But what David does that I think is so good is that he takes the complementary and alternative methods and tells which ones are dangerous as well as which ones are helpful, or which ones may be helpful. How much data are there to how many data are there? What data are there that support the use of one of these methods? And what is there that doesn't support it? Where could they actually do harm? What herbs are harmful rather than beneficial? And you don't get that information very often, and you especially don't get it in a medical textbook.
This is a medical textbook.
That's what I'm saying. You don't get it elsewhere.
No, I'm just joking. The other part of this book that I am proud of.
You better start over.
The book is divided into 3 sections. The first section is the art of what we do. It's that relationship-centered care. It's trying to develop insight into what that person needs to be well based on relationship. The heart of the book is based on disease states: Alzheimer's disease, hypertension, irritable bowel syndrome. And the third section is tools for your practice. How can I actually implement an elimination diet if someone has irritable bowel syndrome? How can I use some of these mind-body tools, self-hypnosis, to avoid a headache? How can I actually apply these immediately in my practice and for many conditions that we weren't taught in medical school, which can be very valuable and very effective.
And the new edition will be online as well?
The new edition will be online. It'll be electronic as well as in print. And as this evolves, it'll all be electronic. So that'll be nice, because we won't have to lug these books around as much.